Hey, so I heard you quit smoking. That's so awesome. With all the bad news going on in the world, it's so great to hear people who make their own good news. But I know it's going to be hard from time to time. It's not easy. So as your doctor friend, I wanted to remind you of some good things that happen after you quit smoking. First of all, within a few minutes after quitting, your heart rate drops. And then after the first day to a few days after quitting, your nicotine levels drop to 0. Your carbon monoxide levels drop to almost 0. A month to a few months after that, your coughing, shortness of breath all get better. After a year to 2 years after quitting, your risk of heart attack drops dramatically. And then if you go to 5 to 10 years after quitting, your risk of cancers of the mouth, throat, larynx, cut in half. Plus your risk of stroke decreases. So you go out to 10 years after quitting, and your risk of lung cancer is about half of that of a person who still smokes. Plus, your risk of cancer decreases for the bladder, esophagus, and kidneys. You go out to 15 years after quitting, your risk of coronary heart disease is close to that of a non-smoker. And then you go to 20 years after quitting, your risk of cancers of the mouth, throat, larynx, and pancreas drops close to someone who does not smoke. And since you're a woman, I'll point out that your risk of cervical cancer is cut in half. So keep that stuff in mind when it gets hard. And I also want you to think about lung cancer screening. So I'll tell you about the criteria you fall in. Ages 50 to 80. If you've smoked the equivalent of a pack a year for 20 years, and you're either a current smoker or you've quit within the past 15 years. And you can get some more information on this at hartfordhealthcare.org/lung cancer screening. All right, so keep that in mind, and also maybe think about all that money you're going to be saving since you're not spending it on cigarettes. I might even suggest that you pick up the check for once.